Coming up on today's All Things Heart, we're sharing the symptoms that led to the diagnosis of a rare disease that often goes undetected until it's too late. This, though, is a story of survival from the father who refused to give up and the doctors who teamed up to save his life. Good morning, I'm Alexis Del Cid. Welcome back to a new season of All Things Heart. Curtis Feather was enjoying retirement when he realized that simple things that used to be easy for him were leaving him out of breath. It turns out his heart was failing and he needed a new one.
Somebody had to die so I could live, and that's always got me.
We share the diagnosis that brought Curtis to the University of Kansas Health System for transplant surgery and cardiologists and oncologists who worked to save him.
That's my grandkids, and that's Dusty and Melinda, my daughter-in-law. Feeling great today. Yeah, I'm feeling real good now.
Curtis Feather is back.
They're little there, ain't they?
Back to health and back to doing the things he loves, like cheering on the Chiefs and the Cardinals.
We'll reserve 20, 30 seats up there.
And spending time with his large family in Sarcoxie, Missouri, including his two sons, Denver and Dusty.
There's cousins everywhere to run around this small town with.
And his wife of 47 years, Kathleen.
Right here, 47 years.
My high school sweetheart, and I loved her so much. She's been here for me the whole time.
The trouble began in fall of 2023 when at 64, Curtis noticed he was feeling short of breath doing the things that he had never struggled with before. Luckily, his yearly physical was right around the corner. And when his doctor listened to his heart, she didn't like what she heard. She sent him for an echocardiogram, and ultimately, Curtis was referred to the University of Kansas Health System in Kansas City. This is where cardiologist Dr. Hirik Shah diagnosed Curtis with AL amyloidosis, a rare blood cancer that can affect multiple organs in the body. In Curtis's case, his heart.
The heart was harder, kind of like a turtle shell, so it wasn't beating like it's supposed to be soft, and beat. And so mine was getting hard, and the blood just wasn't flowing through like it should.
Curtis would likely need a heart transplant.
You don't know what's ahead, and it's very scary. Yeah, very scary.
And that's where health system heart failure and transplantation cardiologist Dr. Zubair Shah and the University of Kansas Cancer Center hematologist oncologist Dr. Al-Ola Abdallah swooped in to collaborate. Dr. Abdallah needed to kick the cancer into remission before a heart transplant was even possible. Curtis needed chemotherapy for several weeks. Finally, by April of 2024, the good news.
When Dr. Abdallah said, hey, he's in remission, it's like Dr. Shaw took the ball and ran with it.
And you're just like, okay, let's go next. Oh, you want to take the heart out? Okay, let's go. But they were good. Like the doctors were good.
2 weeks later, Curtis got his new heart.
One of the cutouts at Busch Stadium.
8 days after that,
Will Shields autographed jersey.
he was back home in Sarcoxie.
And they were all amazing.
They were great. They all treated me well.
Yeah, they are amazing. Yeah.
And he has a message for anyone who will listen.
I tell everybody, I said, at least see your doctor once a year, because I wouldn't be here today if I hadn't done that.
Curtis drove all the way in from Sarcoxie just to be with us this morning. Thank you for making the drive.
Thanks for having me.
We're so happy you're doing well. And we're also joined this morning by Curtis's hematologist oncologist, Dr. Al-Ola Abdallah. Dr. Abdallah is also the director of the University of Kansas Cancer Center Plasma Cell Disorder Program. And joining us virtually, two of Curtis's heart doctors. We have heart failure and transplantation cardiologist, Dr. Zubair Shah. Dr. Zubair Shah is also the director of the cardiac amyloid program here at the health system. And we have heart failure and transplantation cardiologist, Dr. Hirik Shah. What a team. What a team caring for you.
They were great. They're both great. I just can't thank them enough for what they did for me.
And we just love hearing that from your wife as well. How are you feeling physically?
Great. I'm feeling great now. I still need to get some strength back. But overall, I'm feeling great.
Able to do your things,
I'm
and you're
able to do basically everything I could before, just slower and take my time and do it. So,
but you're doing it.
I'm doing it.
Right out of the gate, I do want to get to Dr. Zubair Shah because we only have Dr. Zubair Shah for 15 minutes this morning because he's joining us from a medical conference in Salt Lake City where you're giving a presentation soon because you're kind of a big deal. So Dr. Shah, I want to ask you, AL amyloidosis is described as a rare disease. How many people do you estimate in the United States, have this type of amyloidosis?
Alexis, it's kind of difficult to answer. I think Dr. Abdullah may be the right person. But at KU, we do see a lot of patients with AL amyloidosis. And I kind of manage the cardiac involvement, and Dr. Abdullah manages the overall AL amyloidosis. And it's so common, you know, we only few centers have a program like this where we meet every Thursday of the month, first Thursday, and at least talk about 8 to 10 patients, new patients every month. So for us, it's not that uncommon.
Because we're the only place that can treat patients like this, Dr. Abdallah.
Absolutely. I mean, we have one great thing here. As you can see here, we have a really impressive team. AL amyloidosis, as we can talk about it, it's a very complex disease, you know, that you need a multidisciplinary team from an oncologist to cardiologist, the main players, and sometimes if the kidneys are affected, you need a nephrologist, neurologist, and GI doctors and palliative care. So that's something very unique about this disease, is that you need different team members to play a role in order to treat these patients. So when you're in a comprehensive cancer center and also a well-known cardiology center as well, that teams up to provide a better results for our patients for amyloidosis.
Like Curtis.
Yeah.
Curtis, what other symptoms did you have other than feeling tired and short of breath, doing normal activities that didn't do that to you before?
I could just tell I was getting weaker. My ankles swollen, you know, it just really, you know, I thought, well, I was just getting lazy because I recently retired and sitting around more. I thought, well, I just need to get back in shape and everything. And when my doctor said, it don't sound right, let's do something here. So other than that, I just thought I was out of shape and just getting weaker.
But thank goodness you went to your regular doctor.
Yeah, it's a good, yeah, I'm glad I did. And
sent you to these guys who were able to save your life.
Yeah.
Dr. Shah, you were the first doctor, Dr. Hirak Shah, you were the first doctor here at the health system to see Curtis. So what did you see on the tests that prompted you to send Curtis to Dr. Zubair Shah?
Yeah, Curtis, great to see you, and thank you for having me on the show. Alexis, that's a great question. I think with cardiac amyloidosis, really the test that really kind of, for me, triggered all the subsequent testing was the echocardiogram and the cardiac MRI. You know, cardiac imaging is a very, very important part of this disease process. And when I first saw him in the ICU, I saw his echocardiogram, and his heart was very thick. And there's only a few things that cause a thick heart. We rule out things like high blood pressure and things like that, but he didn't really have any of those things. And right away, you could just tell just on the imaging that there's a way that it looks, you know, speckled in a way, that you could tell that there's something infiltrating that heart. And so based on that kind of got us triggered that, okay, maybe amyloidosis is the condition. And in order to diagnose that, then you do subsequent testing. And we basically check for proteins that, you know, are involved in AL amyloidosis, looking for, you know, light chains, and his were off the charts high. And by then you knew that was the diagnosis, and then you need a tissue diagnosis, which Dr. Abdallah and Dr. Zubair Shah can talk about how they got the tissue diagnosis. But it really was the echocardiogram that kind of started this whole process, because when you look at that echocardiogram, his case, you know, was very classic. When you look at it, that was the first thing that, you know, we thought of when we saw that. I was like, this is amyloid. And the good thing now is that with Dr. Zubair Shah and Dr. Abdallah's expertise, this was a condition that previously might not have had great treatments, but now there are great treatments. And I think that's leading to more recognition of this disease process, because we could really influence and change patients' trajectory when maybe 20, 30 years ago that this was a mortal condition.
So Dr. Zubair Shah, what kind of tests and scans then do you do once Curtis makes it to you?
So yeah, Alexis, I do want to go back. You know, this is very important how Hirak Shah picked it up very fast. I think in Curtis's case, he got lucky. He was at right place, right time, and right person also. Generally, we see a delay in the diagnosis, and which can be very tragic. If their heart is too involved, their organs are too involved, generally treatment becomes difficult and transplanting them becomes difficult. So how quickly he got diagnosed was the main reason, we were able to offer transplant also. So regarding tests, once you do the basic test, that's our blood test showing us that light chains are elevated. These are the proteins that come from bone marrow that indicate that patient has AL amyloidosis. Once they are abnormal, tissue diagnosis is very important. And we can start with fat pad biopsy because amyloidosis is protein buildup. You have to prove patient is building up protein. So we do a fat pad biopsy. If it shows amyloid deposition, we can even go to the organ in like heart endomyocardial biopsy. We take a small sample of heart and then kind of do different tests to prove patient has AL amyloidosis. And in Curtis's case, that's what we did and did very fast. I think within 2 weeks we had diagnosed him with AL amyloidosis.
Where do you take the first biopsy? Did you say a fat biopsy?
Yeah, in the belly, because it's less invasive, you can do that first. Yeah. And 2/3 of the patients who have AL can be positive. But if it's negative and our suspicion is still high, we straight go to heart. And in some circumstances where urgent diagnosis is important, we need timely, like in Curtis's case, you can straight go to heart biopsy because you are seeing heart is thick, or straight going to the organ where you are suspecting the involvement. That can also be a strategy to save time.
Where do you go through the body to get the heart biopsy? Is it done like a catheter through the leg, or do you go in through the neck? So
it's called a biotome. It's like a thickness of a wire, like a phone charger wire, and it has at the tip it has a mechanism where you can bite on the heart. Very small teeth, very small. We go through the neck vein. We call it IJ, and it straight dips into the right side of the heart, and you go. It takes us 15 minutes to do the 15 to 30 minutes actually to do it. It is done under fluoroscopy and echo guidance to be very safe. And I think at University of Kansas, we easily do 200-300 biopsies a year because we have to do it on transplant patients also to make sure body is not rejected. So we are a very high biopsy center with very high expertise.
Right. Curtis, you're nodding your head yes when we're talking about the biopsy. What was that like for you?
It's kind of scary, I'm laying there awake through the whole thing, and like you said, it only takes like 15 minutes. It took them longer to get me ready to go in there than the actual procedure, but yeah, they just went down through my neck. And
are you laying down, sitting up?
Laying on my side, laying on my side, and they said, don't move. And
you have to be real still.
Yeah.
What did it feel like?
Just going in, it was the only sting I felt when they went in, but once they was in, I didn't feel a thing. I could hear squeaking, and doing things, weird noises, but
could you feel like stuff happen in there? You could just hear it squeaking around? Oh, that's kind of weird.
Yeah.
What an odd sensation.
Yeah.
Dr. Abdallah, when people hear amyloidosis, a lot of people just think heart. Can you explain, a lot of people don't think cancer, they think heart. So can you explain the blood cancer part of this?
Absolutely, and I think a lot of people have the right to imagine it's the heart all the time because we always try to, inform a lot of patients and the population. It's a very rare disease. Amyloidosis is a product. It's a protein product, that actually deposit in main organs like the heart, liver, and the GI tract, the nerves, the kidneys, and causes damages. What happened here is that the question is that where are these proteins coming from? Where are these amyloidosis coming from? There are different parts. So there's sometimes from the liver and sometimes it comes from the bone marrow. So what Curtis have here is from the bone marrow. We call it light chain amyloidosis, AL amyloidosis. And these light chain amyloidosis coming from, unfortunately, plasma cells. The plasma cells, which is part of your white blood cells, produce antibodies like kappa and lambda light chain, normally for protecting from infection. Something awkward happened to these plasma cells that causes these antibodies to be shaped differently or misfolded, and it's like I kind of like describe it as a sticky material, the amyloid. And these amyloid, when it deposit in a higher volume, it causes damages to places like the heart, the kidneys, and that's why AL amyloidosis. So yes, there is the portion of cancer which is in the bone marrow. I call it the factory that produces the light chain amyloidosis and causes all the problems that include what happened to Mr. Curtis.
So Curtis, your heart's failing. But before anyone can do anything, they have to treat your cancer first. Dr. Abdallah, how do you go about treating cancer in Curtis with his heart so weak?
Yeah, absolutely. I mean, this is a very important thing, and this is where the multidisciplinary team plays a big role. Like, it's not only a one-man show here. Like, okay, I can take care of the blood cancer and forget about the heart, the kidneys, and etc. You need a whole team, and that's why we have, a dedicated meeting every month, and we kind of like talk to each other, learn about things that we should not miss. What we try to do here is to kill the cancer cells. With a weak heart, we understand that we try to provide the right treatment that is suitable for Curtis in order to get him in remission safely. And the word safely is a very important thing, because you're talking about the heart, the kidneys, etc. You want to give them the right drugs. You want to kill the cancer cells. You want to try to clear everything so that our cardiologists evaluate the patients for things like heart transplant or kidney transplant in the future.
Dr. Shah, Dr. Zubair Shah, you're so passionate about this team that we have here at the health system that manages AL amyloidosis. You and I have emailed about it extensively, and you really wanted to highlight this team. So on the cardiology side, how do you manage Curtis's care during his cancer treatments?
Yeah, I mean, we have a very experienced team. My nurse practitioner, Dana Miller, who has been doing this with me all along for 8 years. Our nurses are very, very experienced. So management is to get them by during this treatment period. I mean, main issues we kind of encounter is they can get into heart failure easily. Their volume management is very challenging. We have to put them on diuretics so that they can pee that extra volume out. But at the same time, it's not a garden variety heart failure. You can damage their kidneys easily. Also, the margin is very narrow where you can diurese them. Then second is, if kidneys are involved, they lose a lot of protein. We call it nephrotic syndrome. We call it albuminuria. That also kind of builds up a lot of fluid. We call it NSRCA, and they can gain 40, 50 pounds easily, and that's very challenging. Sometimes we have to admit them, give them albumin, make them pee. Then third issue is they are very what we call orthostatic. When they stand up, their blood pressure drops, and that can get them lightheaded and dizzy. I think these are the main three, and there's a slew of complications and slew of baggage we have to deal, but these three are the main ones. And honestly, team has highest level of expertise to kind of get them through this period. And then also, I think I would say in US, 10 centers transplant AL amyloidosis patients. You need expertise in it, and you need to be comfortable. These are high-risk patients. Gladly, our transplant director, Dr. Hiraksha, had some experience in Duke also, where he came from. So it's comfortable convincing him to do a transplant on AL patients. Our comfort level is way, way higher than other institutes.
Dr. Zubair Shah, thank you so much for joining us. We know you have to prepare for the talk you're about to give at your conference, so we're going to let you go now. But thank you very much, and we really appreciate your time.
Thank you for having me. Thank you, Curtis. Have a safe journey back.
Thank you very much.
Thank you,
Thanks.
guys.
Thank you. And we're going to continue the conversation with our other Dr. Shah, Dr. Hirak Shah. We have Dr. Abdallah and Curtis as well to continue this. In the meantime, we also have some viewer questions coming in. If you have a comment or a question you'd like us to read out loud during the show, or a question for one of our guests, you can send it right to us right now on YouTube, Facebook, or the All Things Heart email. You can find all the links right there on your screen. Dr. Zubair Shah is such a nice guy. I think he's giving his conference in 15 minutes. Yeah. He's giving the speech, and he's in Salt Lake City, so it's an hour earlier, and he's like, no, I want to do it. I want to see Curtis again. I want to see my buddy, Dr. Hirak Shah. I want to see Dr. Abdallah. So talk about teamwork.
Yeah.
These are your friends.
Yeah.
And coworkers.
That's the best thing about this teamwork.
Curtis, one of the things that you said you were not expecting is when you heard you were going to get a transplant, your doctors then made you start exercising. At that point, what did the exercise look like? You're in the hospital and they put you on an exercise program.
Basically, I just started walking. There wasn't much else I could do, because, so I just started walking. And
they had you walk in laps?
Yes, there was laps, and when I first got there, I could walk maybe half a lap, and I had to stop and catch my breath. And you know, I thought, man, this is crazy. But they said, you keep walking. And
there's your son, Denver.
there's Denver, and that's my granddaughter, Emery, there. And Denver was sat with me, would be in the room, especially the 2 weeks I was in the hospital before the transplant. And Denver and Kathleen was with me all the time. And Denver, he does word search. And he'd sit there a little bit and then get bored. He said, Dad, you want to walk? So
Denver's sitting there with his word search, making you go exercise.
Yeah, and then so we'd go walk. And we'd walk however many, start out like, you know, I could do 2 laps, 3 laps, whatever. And one of the nurses there saw us walking, and as we went by the room, she gave Denver a dry erase marker. Says, here, just mark on his window there every lap you do, so you keep track of how many laps. And we'd do 2 or 3 laps starting out, and we'd do it like 3 times a day. And eventually, the day before my surgery, 2 days before my surgery, we was doing 12 laps, which according to their little sign in the hallway there, that was a mile.
That was a mile, so they
So we
had you
did
walking a mile.
3 times a day though.
Oh, so you're walking 3 miles a day?
Yeah, so we walked in the morning,
in the hospital,
after lunch, and then of an evening, we would go out in Denver, you know, hey, let's go walk.
Dr. Shaw, why is that so important from a cardiology standpoint that Curtis is exercising before he goes into his heart transplant?
Yeah, I mean, cardiac surgery, especially heart transplantations, you know, a big toll on the body. And we are firm believers that the stronger you go into the operating room, the faster you're going to be able to get out of the operating room and recover. And so with a failing heart, it's, you know, the heart is primarily involved, but if your blood flow is decreased, all the other organs start failing, especially your muscles. You know, weight loss and you know, loss of muscle mass is very common in patients with heart failure. And if you get a heart transplant, you know, you fix the heart, but the rest of the body still has to, you know, recover from the insult that was the heart disease. And so we want to keep the rest of the body as stable as possible going into it. And I think for Curtis, honestly, you know, walking those 3 miles, he left in the hospital after 8 days. That's the fastest anyone could ever leave after a heart transplant, because we keep someone at the hospital at least 1 week after for their first biopsy. So day 8 is the fastest anyone can leave. And he did it. And I think a lot of it comes down to all the work he did before the transplant to get him out that quickly.
And thankfully Denver whipped you into shape too.
Yeah, and they told me, Dr. Zubair says, the stronger I am going into the surgery, the stronger I'll be recovering.
Right.
So,
I do have a question about something that Dr. Zubair Shah said, Dr. Abdallah. He said that it's so hard and often misdiagnosed, AL amyloidosis. Why is it often misdiagnosed at other places, whereas you had Dr. Hirak Shah here who said, yeah, I think that's what it is, right away?
That's a really great question. I think the problem about that is that because it's a very rare disease and you need a subspecialized, and Dr. Shah, you know, he's in a very bigger center. He had been also exposed to this type of disease before, so his differential diagnosis kind of like focused on the right diagnostic material for that and kind of like meeting all the criteria for the AL amyloidosis. So as much as we say that, as Shah was saying, Zubair Shah before he left, like, we are very lucky when patients come and refer to us earlier to catch the diagnosis. So if it wasn't for Dr. Hirak Shah, Curtis will have like a very advanced case of heart failure, and that will be a big, you know, a big burden on us all to how we can treat him, how we're going to get him to the heart transplant list very sooner. So it's really timely. Diagnosis plays a big role. It helps everybody. Cardiologists, the oncologists, the nephrologists, everybody will help to treat the cancer very quickly, and get the diagnosis quickly, treat him quickly, and get him into a transplant list very quickly as well.
Curtis, you also gave a lot of credit to your family physician near Sarcoxy, where you live, who looked at you and said, something isn't right.
Yeah, I went for my yearly visit, and the nurse, you know, took my vitals, says, oh, you got the blood pressure of a teenager, so that made me feel good, you know. But then when the doctor actually come in and listened to my heart, she asked me if anybody ever told me I had a heart murmur, and I said, no. And she went to listening again, and she goes, yeah, there's something there, so we need to get it checked out. So she scheduled me for an echocardiogram, like 3 or 4 days later. So it really moved fast.
And once you wound up here, it was like the things started clicking.
Yeah.
One of the things you talked about so much during the interview was how motivating your family was your wife and your son, one of your sons, Denver, came with you.
Yeah.
I mean, that's dedication. They woke up early and drove in from Sarcoxy just to be here to support you. And there they are, sleeping in the hospital. You were surrounded. Oh, is that Denver?
That's Denver.
What a sweetheart.
Yeah, while I was in surgery, they was all out there waiting. So.
How much did that make you feel physically better? We talk about emotionally helping you physically.
Yeah, it just, there's a reason I got to get better. So, you know, and that's just, I need to get for my kids, for my grandkids, you know, I just wanted to, I got to get better to be there for them and to watch them grow. So.
I love these pictures that we're seeing. How many grandkids do you have?
I just have two. Caden and Emery.
And are they going to be watching this program?
I'm sure they will be, yeah.
Do they call you Grandpa, Papa? What do they call you?
Grandpa. Yeah.
Okay. We have some great community questions coming in as well. So I want to get to some of the questions and comments from our viewers. Sally has a really good question. She wants to know, and I'll toss this over to Dr. Shaw. Dr. Shaw, what is the difference between ATTR amyloidosis and AL amyloidosis?
Yeah, that's a great question. First of all, great job, you know, differentiating between both Shaws. That's one of the hardest things, because we both do the same thing, and like it's so brilliant. Confusing in meetings when they're like, Dr. Shaw, it's like, well, which one? So you did a very good job there.
Thank you.
So you know, Dr. Zubair Shah would probably be obviously the best one to ask about this question, but you know, he's taught me enough that I feel I can give this a crack. So again, I think how Dr. Abdallah said it, you know, amyloidosis in general is a very, you know, generic term and kind of is an umbrella term that kind of is basically misfolded proteins that are going to places that they're not supposed to be. And so with that, it comes down to what is the actual protein. And so when you look at TTR amyloid and AL amyloid, it's both abnormal proteins going into the heart, but they're very different proteins. So in TTR, that's the protein that comes from the liver, called transthyretin. That's a protein that all of us actually have that carries our thyroid hormone, carries vitamin A. But in certain cases, either with a mutation or as we age, that protein misfolds and particularly goes into the heart and the nervous system, where people can have like carpal tunnel and back pain and things like that. AL is, like we talked about, is completely different. It doesn't come from the liver, it comes from the bone marrow, from these abnormal plasma cells that produce these immunoglobulins, light chains that deposit into the heart. So in the end, they're both misfolded proteins, but the differentiation is what's the actual protein and where it's coming from. And the distinction is incredibly important because the treatment's completely different. TTR has a very specific treatment. AL has a specific treatment. And getting the right diagnosis is probably crucial in order to get the patient the right treatment at the right time.
Dr. Abdallah, Jeremy, one of our loyal Facebook viewers, has a question. He wants to know if you can remove amyloid, or is the treatment more about just stopping your body from making more of it?
That's a beautiful question, and here is what we are trying to do. We have the great treatment to stop it. We have the best treatment ever, which is great eradication, curing amyloidosis. However, the question that he's asking now, do we have the procedure or the treatment that can go to the heart or the kidneys and remove the amyloid? We have tried to develop these drugs. Unfortunately, it has failed so far. We're trying to find that type of drug which has that mechanism of taking this amyloid out from the body and clean it up. And this will be a tremendous success for the amyloidosis patients if we find this treatment. So this is still an ongoing research studies, yet we don't have it, but we do have the right treatments which we're advancing in stopping the disease from actually causing any more major harm for the patients.
As we wrap up this discussion for today's takeaways, Curtis, what would you most like our viewers to know about your journey?
It is a rough road. You know, it's totally, have no idea what's going on. You know, the doctors explained everything great, you know, but to think, you know, what's happening next, you know, and they guided me through everything, told me what to do, and I followed their directions the best I could. And I just can't thank them enough for everything they've done for me. So, like I say, this team here at KU is wonderful. Everybody treated us all so well, and the concern these doctors have, that is the biggest thing right there, because I could see the concern in their eyes that I need something and quick. So.
Right. Oh, they have a lot of affection for you too, Curtis. Dr. Shaw, that must feel good to hear Curtis say that.
No, it definitely. I mean, you know, full circle moment when I first met him to now seeing him now. I mean, it's great to see. I mean, it's why we do what we do, is to have outcomes like this.
Dr. Abdallah?
Yes, I mean, I think, we're lucky that we had Mr. Curtis coming to KU, get him the diagnosis. We are lucky to have a comprehensive team, Dr. Herrick Shaw and Dr. Zubair as well. This is actually why we're here at KU Medical Center, where we have a great way to communicate with each other in order to benefit our patients. So this is actually a great opportunity for all our patients outside there, for a second opinion, whether it's amyloidosis or any heart diseases, to come to KU to kind of like be evaluated, and make sure that, we are, not missing anything. And we're on your side as well, for providing the best care for you.
Thank you so much for taking the time to join us. And Curtis, thanks for sharing your journey. You have a lovely family.
Thanks for having us.
And to our viewers, thanks for watching. If you'd like to watch or share one of our previous episodes, you can go to our YouTube page, the University of Kansas Health System, for all those links. Coming up tomorrow, a high school soccer star sidelined for more than a year, the rare condition that took her out of the game, and the multidisciplinary care team that helped her fight her way back. Tomorrow at 8 a.m.